Hello, we'd like to welcome you to the PQI Champions webinar, QI Tools for Dismantling Perinatal Racism. We'd like to let you know that the webinar is being recorded. And at this point, I would like to introduce our speakers. Renee Byfield is a clinical leader specializing in obstetric and newborn care. She has been a nurse educator in both academic and hospital settings. At Temple and Drexel University nursing schools in Philadelphia, Ms. Byfield taught in the undergraduate and master's programs. She has held obstetric educator roles at St. Luke's Roosevelt Hospital and Weill Cornell Medical Center in New York City. At Cornell, she became patient safety administrator for the obstetric service, where she coordinated quality improvement and perinatal patient safety initiatives and sat on the perinatal maternal mortality review. She developed and launched interdisciplinary simulation drills and team training as an AHRQ Team Steps Master Trainer. As a senior manager of clinical program development at A1, she authored and facilitated development of POEP and the NOEP 3rd and 4th editions, and the obstetric patient safety program focused on postpartum hemorrhage management utilizing simulation-based training. She has held nurse management positions at Temple University Hospital and is currently a nurse manager for OBGYN, urogynecology, and perinatal quality and safety in an outpatient setting in Georgia. Dr. Debra Bingham is the founder and executive director of the Institute for Perinatal Quality Improvement, or PQI. PQI's mission is to expand the use of quality improvement in order to eliminate preventable perinatal morbidity and mortality and ensure equity in birth outcomes. Dr. Bingham is a public health leader, educator, author, and consultant with over 30 years of experience. She is also Associate Professor for Healthcare Quality and Safety at the University of Maryland School of Nursing. Dr. Bingham has successfully led hospital, state, and national improvement efforts and held key leadership positions. She was the director of maternal child health nursing at St. Luke's Roosevelt Hospitals in New York City, the founding executive director of the California Maternal Quality Care Collaborative, and the vice president for nursing research, education, and practice for A1. Dr. Bingham is a registered nurse with a Master's of Science degree in perinatal nursing from Columbia and a doctorate in public health from the University of North Carolina, Chapel Hill. I'd like now to turn the time over to Dr. Bingham.
Nice to be with all of you today. Just a reminder, hopefully you can hear me okay. And I'll let Renee say hi as well.
Good morning, everyone. Thank you so much for attending this event, and we're looking forward to sharing information, valuable information with you. Thanks again.
Yeah, so just a reminder that this meeting is being recorded. We will be able to share with you a recording of today's session, but the slides and materials all are owned by the Institute for Perinatal Quality Improvement. I agree with the statement of by Dr. Martin Luther King that of all the forms of inequity, injustice in healthcare is the most shocking and most inhumane. And as a nurse, this quote particularly resonates with me. It is important that, and I'm so glad that you're here to help us address and to eliminate this form of inequity and injustice. As was previously outlined, the mission of PQI is to expand the use of improvement science to eliminate preventable perinatal morbidity and mortality and perinatal racial and ethnic disparities. We've also set a Speak Up goal that by 2035, Speak Up champions will eliminate perinatal disparities in their organizations and communities throughout the United States. We know it's an audacious goal, but we know it can also be achieved. For today's webinar, we're going to be going over why PQI created the Speak Up Against Racism education program pathway, outline key elements of the Speak Up program, and discuss how the Speak Up program incorporates quality methods and tools. This is, dismantling racism is possible. It's hard work, but work that is possible and something that we can all do and we can all make happen. We can dismantle racism. QI methods and tools will help us support the efforts to make our efforts more effective. So one of the ways to ensure QI effectiveness is to use QI process models. MAPIT, as shown on this slide, is one type of QI process model. Other very common QI process models is the model for improvement, which is used by the Institute for Healthcare Improvement. Both models use a cyclical approach with small tests of change. So MAPIT includes these 5 steps, and these are important steps that you can utilize in creating and enacting a QI effort to dismantle racism. Mobilize is to assemble your Speak Up QI action team. Assess is to review data and identify QI opportunities. Plan is to develop the action plan, set goals and metrics. And I is to implement the action plan, and T is to track progress using data. So the first step, the first 2 steps in the MAPIT QI process model are to mobilize and assess the situation. And I recommend that when you mobilize a group, you first start with a small group of individuals who are committed and want to work with you to dismantle racism. As a group, you can assess the situation and begin to create action plans and look beyond the myths and find data to dispel the myths. For example, there is a myth that is circulating around the United States and is perpetuated by individuals in power, including the president, that the majority of Black Lives Matter rallies and protests were violent, when in reality, only 93% of the Black Lives Matter protests around the United States were peaceful, multiracial events. In addition, and I never thought that I would ever need to say the following painful words. It's very, when we scheduled this webinar back in December, we had not anticipated any of the actions that have occurred recently. But when mobilizing and assessing efforts to dismantle perinatal racism and support PQI's goal that perinatal racism will be dismantled by 2035, we must dig deep, and we must address the context we are working in. Or what Dr. Camara Jones explains in her allegory of the gardener, we can't expect seeds to grow and flourish without ensuring we enrich the soil where the seeds are planted. So in order to be effective anti-racist leaders, we must address, again, the context in which we live and where we work. We must name and talk about what is occurring in our country. So with that in mind, need to highlight that last week in Washington, D.C., a violent mob of white supremacist radical thugs, many carrying the Confederate flag and many carrying symbols of Nazism, gathered and stormed the Capitol, where there were joint sessions of Congress working to ensure a peaceful transfer of power. The intent of this violent mob was to overthrow the government of the United States and prevent Congress from doing their constitutional duty of confirming the election of Joe Biden and Kamala Harris. We now face reports that violent actions are planned to occur between now and Inauguration Day at the state capitals in all 50 states and Washington, D.C. This level of hate is not new, but what is new is people openly acting to overthrow our democracy and our government in our lifetime. 5 people died last week due to the attempted coup that was incited by the President of the United States and by his facilitators and supporters. Racism was on full display. So I honestly ask you to reflect and ask yourself whether you think the police would have responded with the same level of restraint had the mob consisted of Black people. Would any police officers taken selfies with the mob? Would the individuals been allowed to walk out of the building without being arrested or shot? We are grateful and encouraged by the fact that so many people are joining us today to talk about QI methods and tools that can support our efforts to dismantle perinatal racism. And honestly, our efforts to dismantle perinatal racism are clearly needed now more than ever. I'm now going to go over some very disturbing perinatal statistics that also highlight why we need more Speak Up champions. Infant mortality rates in the United States are very concerning and are very disparate. For example, Mississippi's rate is 8.6 per 1,000 births, live children, I should say, compared to Massachusetts' rate of 3.7. And then within states, we also have varying considerably rates of infant mortality, with white infants, fewer white infants dying compared to Black infants. Our country's statistics on infant mortality are a national embarrassment. Our racial disparities on infant mortality racial disparities are unacceptable. And we must do all in our power as perinatal health professionals to eliminate these disparities. We were able to eliminate disparities related to immunization and we can eliminate the perinatal disparities. They are not genetically mediated disparities. Trends also in perinatal mortality need to be highlighted quickly to just talk about why we need to do this work. In 1987, there were 7.2 perinatal related deaths per 100,000 live births. In 2013, there were 17.3 pregnancy related deaths. This means that there are twice as many pregnancy related deaths now than there were in 1987. Although there are many reasons for this increase, including better counting of these deaths, we know that we are headed in the wrong direction. We also know when we compare our maternal mortality ratios to from the United States with other countries, that the United States is not doing as well as other countries. We lag behind 31 other countries. This shows also that a lot of countries are showing a decrease in maternal deaths at the same time that the United States is seeing an increase. And as pointed out before, we know that there's huge differences, disparities in based by race, ethnicity. There are 3 to 4 times more likely for a woman, a non-Hispanic Black woman, to die when giving birth than for a white woman. And this is what we're here today to talk about. How do we eliminate these disparities? It also helps as you're thinking about your data and assessing the situation, which again are the first 2 steps in a QI process model, is to look at our different states, and we can learn from the states that are doing better than other states. The light colored, there are some states where the number of births for non-Hispanic Black women are too low for them to have calculated an actual mortality ratio, maternal mortality ratio. But 14 states Idaho, Arizona, Texas, Oklahoma, Missouri, Arkansas, Michigan, New York, New Hampshire, New Jersey, Maryland, South Carolina, Georgia, and Florida all have maternal mortality ratios greater than 40 per 100,000 live births. We have a lot of work to do, but again, this is work that will be, can be successful. We can make a difference. Severe maternal morbidity rates also have increased over the same period by almost 200%, from 49.5 in 1993 to 144 in 2014. This increase has been mostly driven by blood transfusion, and also is related to the higher rates of overuse of cesarean births in the United States. So all of these data, I know they're very troubling. They're very hard for me to think about and look at on a regular basis, but I know that if I don't understand the situation and really look deeply at them and not be afraid to look at our data, then the data helps us know what improvements are needed. So consider what data you need in order to collect and use in your QI efforts, and also think about how are you tracking perinatal disparities within your sphere of influence. I'm now going to turn the time over to Renee.
Thank you, Debra, and welcome again to everyone. I want to turn our attention again to more of the why. Why are we doing this? In 2017, this article introduced us to Shalon Irving, a CDC researcher who was working to eradicate racial disparities in healthcare access and outcomes. She died 3 weeks after giving birth. Her death showed us that despite Shalon's advantages, they were not enough to ensure her survival. She, like many other Black women, became a part of the alarming statistic that Black women die 3 to 4 times more often during childbirth. Next slide, please. So Dr. Shalon Irving was very educated, as you see her degrees listed, had full health insurance, and despite seeking and obtaining care during that troubling 3 weeks of postpartum period, she died. Shalon had dedicated her life to exposing how people's limited health options were leading to poor outcomes. In fact, her goal was to uncover and undo victim blame, which I'll define shortly. Her story and this article that was previously shared is what prompted the creation of the Speak Up program. Next slide. Monica McLemore and the preterm labor study of pregnant, birthing, and postnatal women of color at risk for preterm birth found that their healthcare experiences mostly were disrespectful and stressful. And in fact, 5 themes came from this work, this body of work. There was a disrespect during healthcare encounters, stressful interactions with all level of staff, unmet information needs, inconsistent social support, as well as discrimination, racism, and disrespect had a negative impact on their health and the health of their infants. So let's be clear about this. Respectful healthcare is a human right. It is not a luxury. The World Health Organization states that respectful maternity care should be provided to all women in a manner that maintains their dignity, privacy, and confidentiality, and ensures freedom from harm and mistreatment, and enables informed choice and continuous support during labor, childbirth, and beyond. Next slide. Next slide, yes, please, thank you. So mother blame is a term coined to refer to the idea that individual characteristics or behaviors, such as smoking, late entry into prenatal care, being older during pregnancy, or a patient having other chronic health conditions, are exclusively responsible for poor birth outcomes. We need to have a paradigm shift as far as that's concerned. We need to acknowledge that other factors, such as racism, impacts negatively on overall patient outcomes. Next slide, please. So what is racism? By definition, racism is marginalization and or oppression of people of color based on a socially constructed racial hierarchy that privileges white people. Racism is a system. It consists of structures, policies, practices, and norms that provide opportunity and assign value based on a person's appearance, their race. It involves one group having the power to carry out systemic discrimination through institutional policies and practices of the society, and by shaping the cultural beliefs and values that support those racist policies and practices. Next slide. And what is the impact of racism? It unfairly disadvantages some individuals and communities and unfairly advantages other individuals and communities. And in Camara Jones's own words, the system of racism undermines realization of the full potential of our entire or our whole society because of the waste of human resources, because we do not value the potential contributions of the children living in our ghettos, barrios, or reservations, because we feel that we can get along very well, thank you, without them. We do not invest in developing their genius, and it is lost. Just imagine where our nation would be if we truly valued all of our people as precious resources and allowed each the opportunity to know and develop to their full potential. Next slide. So although race is a social construct that doesn't biologically exist, how we identify with race is truly very powerful, that it influences our experiences and shapes our lives. In a society that privileges white people and whiteness, racist ideas are considered normal throughout our social media, our media, culture, social systems, and institutions. And historically, racist views justify the unfair treatment and oppression of people of color, for example, with enslavement and segregation. While racist mindsets and actions demonstrated in individual choices are damaging, racist ideas and policy, that invisible racism, have a widespread impact by threatening the equity of our systems and the fairness of our institutions. To create an equal society, we must commit to making unbiased choices and being anti-racist in all aspects of our lives. So I challenge all of you to move forward with becoming anti-racist in your everyday life. If you see systems, to really have the goal of dismantling racism universally. And Debra, I'll hand it back to you.
Thank you, Renee. One of the ways that we at PQI are combating and working to dismantle centuries as structural and individually mediated racism is supporting efforts to change the conversation. At PQI, we created the Maze of Life image to help illustrate the fact that the starting point and the path for Black women is a more difficult path, more twists and turns and more obstacles than the path most white women embark on in order to achieve health and prosperity. The Black woman is weighed down with a backpack that says 246 years of slavery, which frankly, due to my white privilege, I hadn't thought about how many years slavery existed until, I'm embarrassed to say, recently. And the backpack also has the words fear of dying, These are very, very heavy burdens that women entering our healthcare system are carrying. At the start of her path are Jim Crow laws, racist policies, unequal human rights, legalized rape, disproportionate incarceration in the context of lynching of loved ones or fear of lynching, which then led to families being separated, high rates of infant mortality, redlining, breastfeeding white babies, police violence, disparities in educational resources, unsafe water, limited access to quality health care, and other dead ends that make it all more likely that a Black woman will experience morbidity and mortality when giving birth in the United States. The maze shows that Black women can achieve health and prosperity, but the path to health and prosperity is much longer and more difficult to navigate. The maze also shows that a white woman can experience maternal morbidity and mortality, but it is less likely that she will experience those outcomes. We cannot change the past, but we can learn from the past and be aware of how the past is affecting today, and eliminate and dismantle all racial disparities by dismantling racism, being anti-racist, as Renee pointed out. It is possible, and it will take a lot of effort from everyone, including white people, to eliminate perinatal racial disparities and dismantle racism in perinatal care. And Amanda has put up the link to how you can access the Maze of Life. We have it available on the website as a free download, and you can use that for helping educate and helping mobilize others to work with you on anti-racist efforts. We at PQI also created another free image that you can use to help explain the difference between equality and equity. You may have seen the baseball image, the baseball game image, but there's quite a bit of distinction between our image, which is women-centered, pregnant person-centered. This image compares equality to equity and is a visual illustration of some of the points we want to make that we make in our education. Each of the pregnant people in this image have the same size and number of boxes. They are all the same height. They are in the vicinity of the tree, but the ground underneath the women is structurally different. The ground under the tan person is higher than the ground under the pink and purple people. Having the same number of boxes is treating everyone equally. But even if everyone has the same number of boxes, that doesn't mean that they all can reach the fruit. The other part of this image is that there are 3 extra boxes in the equality side of the image. This signifies that there are extra boxes to go around and enough to spare. How these extra boxes are distributed is how we eliminate disparities and ensure equity. So so equity is how we ensure everybody gets the resources they need to reach the fruit. Giving the purple person 2 more boxes doesn't mean that that person gets more fruit. It means that they are able to reach the fruit that the tan person was already able to reach. This image also can be downloaded. This is the Socioecological Perinatal Disparities Ishikawa diagram, or the fishbone diagram. And this diagram helps identify specific causes and subcauses of perinatal disparity. QI initiatives should look at the root causes of the disparities within their organizations, and a fishbone diagram is a very helpful tool, a QI tool that will help a QI leader be able to work to dismantle racism. You would work to identify which of the causes and subcauses you want to develop a QI initiative around. And then once they've been identified, deciding how you're going to approach each of those issues. So for example, you can see I had, and this Ishikawa diagram is not meant to be completely all-inclusive, but it is meant to really help answer the question of where do I start? How do I get, what could I work on? So under the community factors it talks about teams lack diversity, and so you need to look deeper at your hiring practices and look at ways in which, if that was an issue at your facility. And you could also look at how are they recruiting, what schools are they recruiting from? Also, how are you working with academic institutions regarding encouraging people of all different races and ethnicities to be admitted to the different schools. So wasn't that long ago that Black people were not allowed to enter into nursing schools. Yeah, and the fishbone diagram is available is free on the website, on PQI's website. You can download it. It's also part of an article that we published about a year ago that has some other information in it, and it's all about this topic of today's webinar, which is using QI to help to dismantle racism. So yeah, we don't have time to go in total detail on that particular diagram, but it is there for you to look at, and you can think about, you could do your own fishbone diagram for your own organizations, for your own community. So all right, so now we're going to outline some key elements of the program, and I am going to talk about a little bit about the Speak Up acronym. And again, you can, on the website, you can download this acronym, which is also a mnemonic. And this is, how can I speak up against racism? People think about, well, obviously we want to make changes in public policy, but also we individually can make lead actions within our organizations, within our sphere of influence. So this acronym and mnemonic are to help us think about all of the ways in which we can dismantle racism and how we can set up our QI initiatives from a racial justice and anti-racist perspective. So S is for set limits, allow only racially respectful speech and actions in your workplace. P is for practice and prepare. E is to express concerns. A is to apologize. K is to keep improving. U is to uncover, and P is to persuade others. So Renee is going to go over each letter of the acronym. So I'm going to turn the time over to Renee.
Thank you, Debra. And as this slide says, conversation is where change begins, and we have the power to change the conversation. So this acronym will give you the tools to think through and prepare for when you're going to be or engage in anti-racist work. And that can be in your daily interactions and beyond. So let's go to the next slide, please. So S, set limits. Allow only racially respectful speech and actions, not only in your workplace, but in your everyday life. Adopt the attitude that one of our leaders, Rose Horton, has been promoting, not on my watch. Tell your coworkers, family, friends that you will not tolerate disrespectful speech or actions to occur in the areas that are surrounding you. And get comfortable with disrupting inappropriate actions and any speech that is occurring. Next slide. Practice and prepare. You know, these conversations are never easy, but I think with proper preparation and anticipating that it will eventually come to, or you will be faced with, inappropriate conversations. And maybe you have not said anything in the past, but plan to do so moving forward. Plan how to act and how to disrupt conversations and behaviors, including those that may be a joke. If these conversations or behaviors are disrespectful, racist, or dehumanizing, you have the obligation to make the difference and to not sign on with them with your silence. Encourage everyone to be treated in the manner that you would like to be treated. Next slide. Express your concerns. Yes, this takes courage. Be bold, clear, straightforward. It is difficult but necessary that you voice your concerns and be an example. Next slide. Apologize. Say you're sorry. Do not attempt to validate your own comment by implying that the other person is overreacting or reacted poorly. And make sure that your apology is truly sincere. So for example, saying, I am sorry you perceived what I said to be racist is not sincere. Truly be sincere and change the behavior moving forward. Try to ensure reconciliation if you said or did something that perpetuates racism. And also be open to learning from the feedback that you receive. Next slide. Keep improving. Be courageous, become aware of your implicit and explicit biases. Again, that can be very challenging, but start off with the understanding that everyone has biases. I think when we accept that reality, then we can move forward to say, these are mine, how am I going to mitigate them? Ask for feedback, analyze that feedback, and then implement changes. This will all help you move forward with your efforts to make a change and to help others change. And I always say to Debra, sometimes I'm not going to be in certain conversations based on my race. Okay, so when you're a part of those conversations that maybe a Black person may not be involved in, that is your opportunity to make a difference, to make a change. And the same thing on my side. It's those private conversations where people feel they're most comfortable to have a racist standpoint or a point of view that you can really make the change. Next slide. Uncover and learn. Some well-intentioned individuals think if we stop talking about racism, somehow magically it will disappear and no longer be an issue. But we know that avoidance is ineffective in resolving any problem. So be curious, mindful, and open to new perspectives as you deepen your understanding of racism and its harmful impact. But also do understand that a person is not obligated to teach you how to be an anti-racist. We all have our responsibility to do the work and to learn on our own, as well as to seek feedback. Next slide. Persuade others. Spread the word. We can make a difference. We can move the needle on this, but only with a concerted effort towards the greater good for everyone. I challenge you all to speak up. As this slide says, our words and actions are very powerful. Make sure that you're making the difference. Make sure that you're part of the change we seek. Thank you. Now we're going to move towards discussing how the Speak Up program incorporates quality methods and tools. As we always say, Speak Up is, and the whole concept around this is a journey, not a sprint. It takes commitment to staying the course and to being able to look introspectively, to look at ourselves for our biases, and to move forward with change. Expect and accept that this is a journey. And with that, I'll turn it back to you, Debra.
Yeah, so I do want to underscore that I'm on my own journey. I am still learning, but I committed to step onto this path and to be able to learn and share. And I just want to highlight how grateful oh dear, I'm getting emotional. How grateful I am to Renee for all of the ways in which she encourages me and also helps teach me on this journey, as well as many, probably many of you on this call as well. So when, as I'm learning and as I'm trying to progress on my own journey, I'm sharing that as well. But that's part of being a QI leader, is it's not only about trying to get everyone else to change, but recognizing that each one of us have our own pathway in which we need to change. Oh, and thanks. Somebody's like, yeah, it is an emotional journey. I appreciate it. I'm not the only one that gets emotional about this. I mean, these women are dying. Things are really hard. These conversations are not easy, and it's also hard to acknowledge our own racism and how we have been complicit, especially white people. There's just so many things that I just didn't even pay attention to because I didn't have to, because of the color of my skin for so many years. So it's just time to change all of that. It takes all of us really working hard together. So with that, that's why we came up with a pathway. We hope we have quite a few people already on this pathway with us. Over 400 people have completed the Speak Up Champion training. And the first steps of the pathway are steps 1, 2, and 3, which is to become a Speak Up Champion. And we highlight those as being, and ultimately we want to have every perinatal health professional in the United States to really be a champion and speak up against racism, which includes attending workshops, doing some self-reflection, taking some modules to learn and really dig deep. This isn't work that's going to be done in a 1-hour webinar or a 2-hour session. This is ongoing, careful, thoughtful, introspective work. The next things you'll see down at the bottom of this pathway, and you can download the pathway. Amanda put the link in the chat. This pathway, so you can study it in more detail. But then after you've done steps 1, 2, and 3, then we're offering ambassador training, as well as Speak Up faculty training, because it's Renee and I alone cannot expand this work. We need to have other people, other faculty people joining us in helping spread this work. So, so here's some Speak Up Champion activities, things that we recommend you do. You can start to do these today. You can form a Speak Up Action Committee. You can sign the Speak Up Pledge, which is on our Speak Up program page on our website. You can complete the RACE IAT self-assessment that's out from Harvard. Create, finalize, and implement a Speak Up action plan. You can review your policies and procedures. If any of your policies talk about being Black as a risk factor, then you need to look at that deeper, for example, because it's not the color of someone's skin that is the reason why they have worse outcomes, or it's not because of anything about them in particular. It's because of how we are treating people differently because of the color of their skin. So updating data systems to track outcomes by race ethnicity, creating an anti-racism organizational statement. Every hospital in the United States that should have an anti-racism organizational statement that guides all of your work and assessing everything from health equity and racial justice perspective. Attending a Speak Up Champion Zoom training, reading books and having book clubs, discussing those books with other perinatal health professionals are all really key activities of Speak Up Champions. So one of the other key elements of the Speak Up pathway is to attend an 8 hours of Speak Up Champions implicit and explicit bias education. Right now, because of COVID, these are being taught virtually. We shifted all of our education to be in the virtual space. We teach 4 hours on day 1 and 4 hours on day 2, and there's a CNE for anyone who completes those training sessions. The space is limited, only a few. We do not allow everyone to register for these events, as many as want to, and we do have one coming up in February, the February 16th and 23rd. And so there is still space in that February Speak Up Champions educational sessions. We also will be offering in 2021 the ambassador education, the Speak Up Ambassador course. This course will only be individuals who's completed the Speak Up Champion course will be invited to register for this course. There will be a fee to attend this course, but it will not be open to individuals who have not already completed the 8 hours of Speak Up Champion education. On October 15th, there will also be a Speak Up Champions faculty program, and in order to even be considered to be faculty, individuals must have completed the Speak Up Champions course and also the Ambassador course. So we will start with probably only a few people this year who will become Speak Up faculty. You also need to have a partner depending on your race. So this way, the Speak Up program is taught in tandem with a white person and a person of color. So if you're interested in becoming a Speak Up faculty, then you need to first again attend a Speak Up Champions training program, and you also need to attend the Ambassador program, and then you need to apply to attend the faculty training program. We have an on-demand Speak Up modules that some of the hospitals who are working with us are having their staff go through these 3 modules as a first step. These are complementary to the live training. They reinforce many of the principles. They include additional information. The pledging to Speak Up talks in great detail about implicit biases, different types of implicit biases. We will never eliminate our implicit or unconscious biases, but by becoming more aware of them, then we can start to make more choices around our biases and start to understand our blind spots. And then the How to Speak Up includes is based on QI methods and tools, and it includes information on how to set goals, and includes some sample action plan with action planning tools included, as well as examples for each of the letters of the Speak Up acronym. You can get these now at PQI store if you were interested in looking at them and going through these modules and wanted to really jumpstart your efforts on the pathway. The other thing we're offering is, this is free, is a 28-day anti-racism challenge. It really, this is geared particularly to the audience of perinatal health professionals that can be doulas, community birth workers. It also can be, is for physicians, nurses, midwives who work in perinatal health care. Anyone in the community could also join. They don't have to be necessarily a perinatal health professional to learn about perinatal, to join efforts to help reduce, to eliminate perinatal disparities, and to join the anti-racism challenge. This particular anti-racism challenge is also, you can register if you want to get daily email reminders. You don't have to register to participate. You can do it on your own time, but you can, if you want to get daily email reminders starting on February 1st, then definitely feel free to register. The registration is live on our website, and again, it's free of charge. You can just join with us on this 28-day challenge. I'll be doing the challenge as well, and we'd love to have people post how their challenge is going. again, we want to emphasize that change is possible and change begins when we all speak up. Research is clear that that conversation is how change begins. And so we need people out there speaking against racism and really changing the conversations and really being courageous in what they say and how we act towards eliminating racism. This quote by Dr. Martin Luther King also causes me to be pretty emotional, because it just reminds me that that in the end we will our colleagues, our Black community members, our friends, people of color from any race or ethnicity will remember not the words of our enemies, but the silence of our friends. So just, I know from personal experience that QI saves lives. Your efforts, you will save lives by working on this topic. And so I really want to strongly encourage all of that efforts. We now have a few minutes that we can take, we can respond to some of the comments that were in chat. And so I haven't been, because I've been speaking, I haven't had a chance to pay attention to everything that's been said. And so Amanda, do you want to highlight a couple of the questions? Well, I see one real easy one right now is that somebody's looking for the link to the 28-day Speak Up Challenge on the website. So if you hover over the Speak Up program on the website menu on the main page, you should be able to see it.
I'm just going to add I'm going to send the questions to panelists, so you should be able to see them now when I send them.
Okay. There was one question about a white woman. Someone says that I'm a white woman beginning to work in a homogeneous community with little recognition of racism against Black, Indigenous, people of color, individuals, and deep poverty among white persons in the community. Do you have any tips for addressing disparities in an environment like this? We went through quite a few of our tips for where to begin with starting this type of work in your community. And I think just having honest conversations with people and finding some people that can work with you on putting together your committee and all of that. So that's where I would start. I would also, I think some book clubs, journal clubs also are very helpful. Trying to help people start to begin to see the disparities and the differences in how people are treated and talked about. So pointing it out in ways that are help bring that to people's mind. Renee, what else would you add to that question? Renee, you might be on mute. We can't hear you.
Oh, I'm sorry, Debra, I was. I have nothing to add at this point. I was reading some of the comments, and I think you've said it all, just going through.
Okay, great. Amanda, could you post, somebody had a question about when the ambassador training and faculty trainings are. Do you mind just posting that on in the chat for people so that you could have that? The next opportunity, in order to qualify to attend those trainings, you would need to attend the February Speak Up Champions training, the February 16th and 23rd. We have not publicly released the dates other than today for the ambassador and faculty training, but wanted to put that out there. It's like save the dates. Somebody asked if we offer scholarships for the courses, and at this time we have kept our offerings without any kind of sponsorship. And some organizations have provided funding for some private events, but we have not put these with others. So we don't, the short answer is at this time there are not scholarships available, but that may be something that we would be able to offer in the future. Okay, let's see. Yeah, so there's some people that are just making sure clear understanding about risk assessment. Somebody put in here around using the VBAC calculator. So I don't know if all of you have know this, but there was an article in the New England Journal of Medicine called Hidden in Plain Sight. It wasn't specifically only about OB. It was talking about risk adjustment models and tools that are used throughout healthcare that have that actually include risk adjustment models that actually disadvantage people of color. And if you were using those risk adjustment models in, like, the VBAC calculator is one of those tools that use data to drive their calculator, but the data was obviously affected by disparate treatment of Black people or people of color. So it's almost like a self-perpetuating problem in that the calculator is driven by data that was based on racism and disproportionate treatment of Black people, because as pointed out by Dana, there is no physiological reason why a person of color would have higher rates of C-sections. And so there's been a whole article published about that, which the New England Journal of Medicine then further highlighted this VBAC calculator as being really something that perpetuates inappropriate racial distinctions. And the authors of the VBAC calculator I hear are working on revising how that calculator is, how to use that calculator. But yeah, so if you email info@perinatalqi.org or I can include in our follow-up email information for all of you of how to dig deep into that topic and understand that, because I know that's a very common tool that's used. But that's what I mean when I say look deeply at your policies, procedures, look at the tools you use, look at how you're making assessments, because those could be perpetuating in ways that you didn't even intend or mean to have happen.
I'd like to address something.
Yes.
Put into the chat. And I know you know, I've been very quiet because I've just been pondering this question. Someone put into the chat, can everyone be racist? And was a little taken aback by some of our comments. And I want to challenge all of you. The issue is not if everyone, or to take it personally that can everyone be a racist? It's bigger than that. We're talking about a disparity that can change the whole face of maternal mortality. By focusing on the lowest hanging fruit, which are the disparities that we are seeing, and that we can, though it is challenging, that racism is clearly wrong. And I'm hoping that my colleagues are saying to themselves that racism indeed is wrong, that we can change the tide by doing away with something that is harmful to everyone. Racism affects everyone negatively. So it's bigger than your personal feelings about racism. It's doing something to better and improve the care of the nation. So I challenge all of you not to take this is not a personal attack. We are trying to do what we are called to do. And I remember very clearly taking on my responsibility as a health professional, that I was to do no harm and to do right by the patients that I cared for. So that is the higher challenge that we all are called to as health professionals, and that it's not about you. It's about making sure that we are taking good care of everyone under our watch. So this is a call to action for all of us.
Thank you, Renee. And I would underscore that absolutely. And I think, I don't think it's a matter of good and bad people. I think all of us have been, it's kind of like, I forget who wrote this paper recently, but it came across my desk, is that there were these fish swimming in the water, and one of the fish comes up to and is new to the group and says, "How's the water here?" And the other fish says, "Water? What water?" Like they didn't even notice it. You know, like it's sometimes we just kind of opening our eyes, some of us, and trying to help do it in a way that, be humble enough to see things and learn from each other. So I know it's time is now we have run out of time. I do want to mention one last thing before everybody heads off, is that we have a time-limited opportunity for you labor and delivery nurses to participate in a national study to document the care that's provided in labor and delivery during a pandemic. And the lead principal investigator for this research study is at Boston College, is Dr. Joyce Edmonds, very highly respected researcher. And you can link to this study and on our website. You can find it under events. You'll see the study listed there, and you can go in and respond to the study and let us know if you're willing to help recruit people to participate in the study. So thank you again for being here today. We appreciate all of your comments and also willingness to join us with our efforts to really dismantle perinatal racism in the United States. And I want to just once again thank my dear colleague Renee Byfield for all of her sharing of all of her expertise and helping us here at the Institute for Perinatal Quality Improvement. So anything else you wanted to add, Renee, before we close out?
Thank you for attending, and we hope all of these tools will be valuable, and I hope to see you in one of our sessions.
Great, thank you. All right, bye.